All right. Top of the morning, top of the evening, top of the night, whatever time zone you are on, we are live again. This is a COVID-19 update, and we said we would leave the www. How dumb can you be behind in 2020? I need the US to get there 100%. I will come on again tonight. Let me shut this down in the background. Cue that up. Okay. In the background, I have the video queued up from the Hill today with the House speaking to the CDC and those who are in authority to make a decision right now, today, pertaining to the COVID-19 outbreak and spread here in the United States of America. We're talking about the health professionals. We're talking about those who are in charge of the Center of Disease Control, and we're talking about the legal authority that they have to make a decision today that could impact the lives of people. So I will let you hear what's being said that way. Quick updates. China, they got theirs under control now. They're on their way to Germany. They left going to Germany to help them administer tests and some type of vaccination or whatever they have available. One of the reasons China got theirs under control so quickly is because, remember, communistic parts over there in China, and what they did was shut the nation down. They were not allowing people to even leave out of their neighborhoods, off their streets, until they got it contained. Unfortunately, we have sitting in this White House a mamsy-pamsy, nonchalant, cavalier, disrespectful, one people deem as a president who set up and played around with American lives. Whether you pink, polka dot, black, white, whatever. This is a national crisis for real. So, started off with just a few, more than a few, and still, we get foolishness coming from number 45. Okay, it's a bill that the House has been trying to push, working with the senators. And they're calling it, oh, the Democrats are trying to fulfill their dream. And it's to get aid to people who need help today, right now, right here, right now, pertaining to medical expenses, pertaining to those who will lose wages due to job loss, pertaining to unemployment, just a host of things. And we have people sitting on their behinds, playing around with other people's lives. This is why voting matters. This is why we cannot afford to become despondent and disengaged. This is why you push back. But let me go here. No, so you all can hear it for yourself. Yeah, and when we get to the bottom line, they're being asked, are the medical professionals who are out there working in the field, can they get tested? Since they're going to be the one that's administering medicines and test kits to other people, can we cover them? And while covering them, can we make this testing for COVID-19 free? Since there was a failure for the US to get a handle on it. Let me go there really quick. I already have it queued up in the background. And sorry for the clicks in the background. Let's go, let's get started. Now, if you want to listen to this for yourself, you can timestamp it at starting at 8:10 when Debbie Wasserman Schultz comes right in with the questions that so vitally need to be answered by this administration and from the Center of Disease Control. Okay. And hello, Ellen, and to the rest of the people in the chat. This was streaming live earlier today, and I happened to catch some of it. I get all of it, but I bet you people are paying attention now. Excuse me for the shakiness as I get this set up in the background. And this came today. It's finally here. Yeah. Mask came today. It almost took a month to get here. They're here now. But here we go. Let's go. Let's get started.
Public health labs. There's also clinical medicine, the practice of clinical medicine. The private sector that actually tries to provide diagnostics so we can diagnose diabetes or anemia, lots of different diseases. And it's really the engagement of the private sector to get these tests into clinical medicine, which is, it's a partnership between the private sector. CDC usually develops the test first, gets it out into the health departments to do surveillance, and then the private sector comes in to provide the clinical tools we need to basically diagnose patients, not the surveillance of the community.
Okay, thank you. The gentlelady from Florida, Ms. Wasserman Schultz, is recognized for 5 minutes.
Thank you, Madam Chair. Dr. Redfield, yesterday my colleague, Mr. Raskin, asked you about a nurse in California who was quarantined after treating a patient with coronavirus and showing symptoms of the disease herself. She couldn't get tested, if you recall, even though her local public health department recommended one. She said this, and I quote, "The public county officer called me and verified my symptoms and agreed with testing, but the national CDC would not initiate testing. They said they would not test me because if I were wearing the recommended protective equipment, then I wouldn't have the coronavirus." Dr. Redfield, when you were asked about this yesterday, you said this, and I quote, "This is a misunderstanding if it did occur." You testified that, quote, "The test was always available in Atlanta, where CDC is located. If you sent the sample to us and there was never a time when a health department could not get a test, they had to send it to Atlanta." You claimed that CDC's testing criteria never placed restrictions on who got tested, rather that was only guidance, and quote, "We always left the discretion to do testing to the local public health group." So the committee staff reached out to National Nurses United, the union representing this nurse who was not able to receive a test. And they sent us the following statement last night. And Madam Chair, I ask unanimous consent that this statement be entered into the record.
So granted.
According to National Nurses United, in recent weeks, our union has been made aware of multiple circumstances, and the statement is up on the screen, multiple circumstances in which healthcare workers have been exposed to COVID-19 infection and have not received COVID-19 tests despite requests for testing. They continue. There have been too many cases where exposed healthcare workers have been refused testing for this to be considered a misunderstanding. Further, members of our union across the country have reported countless cases in which testing has been refused to patients when clinicians have recommended it. Dr. Redfield, the national union that represents nurses across this country just issued a statement publicly contradicting your testimony yesterday before this committee. So I ask this question, will you admit that there is a serious problem in this country with individuals, even healthcare workers, obtaining access to testing for coronavirus? You have to turn your mic on.
Thank you for your question, Congresswoman.
You're welcome.
I'm going to be looking into this in depth, as I said yesterday. Clearly, we need to protect the healthcare workers on the front lines. In general, these are local decisions on which healthcare workers need to be tested and exposed by
Okay, but these are workers, these are people who contacted CDC, and it's CDC that they say turned them down and said that they couldn't be tested.
And I will look into that in detail and get back to your office as soon as I can.
Well, as soon as you can, hopefully will be today. There are countless more examples of problems with people getting access to tests all across the country, including in my home state of Florida. We need to have someone in charge of making sure that as many people as possible across this country have access to getting tested as soon as possible. Who is that person? Is it you? Is it the vice president? Can you give us the name of who can guarantee that anyone, but especially healthcare workers who need to be tested, can be?
As I tried to explain to Congressman Green, from the CDC perspective.
Okay, I'm asking for a name. Who is in charge of making sure that people who need to get tested, who are indicated to be tested, can get a test? Who?
Yeah, I was trying to say that the responsibility that I have at CDC is make sure all the public health labs have it, and they can make the judgment on how they want to use it.
But they're referencing people who have been advised to be tested to you, and they've been turned down. So is it you?
As I said, I'm going to look into the specifics.
I know that.
There.
So basically you're saying, for claiming my time, basically you seem to be saying, because you can't name anyone specifically, that there's no one specifically in charge that we can count on to make sure that people who need to be tested, healthcare workers or anyone else, there's not one person that can ensure that these tests can be administered. Yes or no?
My colleague is looking at me to answer. Here we go.
Okay.
All right. So,
and I do have another question, so if we can kind of get
so very
to the
quickly,
question.
the system is not really geared to what we need right now, what you are asking for. That is a failing.
And failing, yes.
It is a failing. I mean, let's admit it. The fact is, the way the system was set up is that the public health component that Dr. Redfield was talking about was a system where you put it out there in the public and a physician asks for it and you get it. The idea of anybody getting it easily, the way people in other countries are doing it, we're not set up for that. Do I think we should be? Yes, but we're not.
Okay, that's really disturbing, and I appreciate the information. Madam Chair, if I can just quickly ask my other question, which is the question I wanted to ask yesterday. We have in my home county, we have 4 positive Port Everglades workers who were tested positive for coronavirus. These employees, according to our State Department of Health—
I'm gonna stop right there, and I'm gonna fast forward it to the next point, because I want people to hear this coming directly from the people who have the authority to make a decision today on whether or not people are going to get tested. And so you heard it. You heard it from those who are in charge. They're not prepared. They can't even do what China did over in their nation here in the United States of America, because they are not prepared. They are not ready. And then you had this administration with the WW dots. How dumb can you be, sitting around calling it a joke, a hoax, a political game, people trying to score political points, when American lives are at stake and have been lost. So we've had some casualties, true, yeah. Casualties are popping up every day, true. We don't know the ramifications or the full extent to which this will impact the US, but let me say this, they are not ready. If 1,000 people test positive for this today, they are not ready. They're not ready. They're not ready, you just heard it. They're not prepared. They are not ready. Here in the United States, which is supposed to be the greatest nation on the world, they're not ready to handle a health crisis. They're not ready to handle this pandemic. They are not prepared. So I'm gonna go there tonight, because people want to say this administration was the same as a previous administration, Obama administration. Oh no, the heck it wasn't. I'm gonna finish that tonight. I'm gonna roll Ebola, H1N1 back, and then I'm gonna go hit that stock market. And we're gonna look at the finances real quick, because I'll say it again, it's a bill in a House that's similar to, that's a little mini or preemie to the stimulus, what the stimulus package, which none of the Republicans voted on in 2009 to help the American people right then and there, instantly, instead of waiting, because they needed money then and there. When our economy was taken, we needed it right then and there. We didn't need capitulations. We didn't need people to wait. Well, they voted no. They're doing the same stupid stuff today. They're sitting up on their behinds, holding up fundings that other people could be getting. Households who are suffering, households who will be suffering. They're sitting on their butts passively, playing a political game with the lives of American people, with the finances of the American people. Okay, so let me roll on to the other part that I want people to hear, because I said free testing. Okay, I need you to hear this from their mouths. This is on the Capitol Hill, the House, with the medical professionals who were put in charge and over these departments to look out for people. And you hear the nonchalant cavalier responses of one, the first one with the glasses, who's in charge of the Center of Disease Control, deflecting and passing off his responsibility and blame to another. No, sir. Now, let me play this next part, and you're gonna hear why for yourself, because all right. Let me make sure I got it queued up. Current inventory in the health system, we don't know. Okay, I'm gonna roll a little bit into her. I listen to her too, but I want to get to the one who has her whiteboard up there. Like we brought our whiteboard up yesterday, and it just goes through and makes it very plain. Let me do the share and go right there to her. Because what I've been telling my mom is I'm gonna need you to stay out from being in the open, because her system is already compromised. I mean, they got you diagnosed with diabetes, this and that, and all these other things. Well, no, I don't need somebody who already has a weakened immune system out there running around. I don't need her to be out just going throughout Michigan. And if you have any family member, whether they are young or old, with a compromised immune system, with any type of disease, high blood pressure, diabetes, congestive heart failure, asthmatic problems, any type of compromised immune system, make sure they're at home and away from large crowds of people. If they have to go out, make sure they are masked and covered up from the top of their head to the bottom of their feet. Please. So let me stop talking. Here it goes.
Are being able to get access to testing and all those things. And I think it's really critically important that we understand that urgency, because on the ground, offices are being closed, businesses are being closed right now, not just large events.
Okay, thank you. The gentle lady from California, Ms. Porter, is recognized for 5 minutes.
Dr. Kadlik, for someone without insurance, do you know the out-of-pocket cost of a complete blood count test?
No, ma'am, not immediately.
Do you have a ballpark?
With a copay, ma'am?
No, the out-of-pocket, just the typical cost.
I do not, ma'am.
Okay, the CBC typically costs about $36. What about the out-of-pocket cost for a complete metabolic panel?
Ma'am, I'd have to pass on that as well.
You have any idea? You want to take a ballpark?
I would say $75.
Okay, 58.
Getting closer.
How about flu A? The flu A test?
Ma'am, again, I would take a guess at about maybe 50.
43. Flu, this is like the Price is Right. Flu B?
Too high again. I would probably say 44.
That's good. How about the cost of an ER visit for someone identified as high severity and threat?
I'm sorry, ma'am, what was the question again?
How about the cost of an ER visit for somebody identified as having high severity or high threat?
High severity, but ma'am, that's probably about $3,000 to $5,000.
Okay, that is $1,151. This all totals up to $1,331. That's assuming they aren't kept in isolation. Isolation can add up for one family already, $4,000. And fear of these costs are going to keep people from being tested, from getting the care they need, and from keeping their communities safe. We live in a world where 40% of Americans cannot even afford a $400 unexpected expense. We live in a world where 33% of Americans put off medical treatment last year. And we have a $1,331 expense, conservatively, just for testing for the coronavirus. Dr. Redfield, do you want to know who has the coronavirus and who doesn't?
Yes.
Not just rich people, but everybody who might have the virus?
All of America.
Dr. Redfield, are you familiar with 42 CFR 71.30, excuse me? 42 CFR 71.30. The Code of Federal Regulations that applies to the CDC. 42 CFR 71.30.
I think if you could frame what it talks about, that would help me. I don't relate.
Dr. Redfield, I'm pretty well known as a questioner on the Hill for not tipping my hand. I literally communicated to your office last night and received confirmation that I was going to be asking you about 42 CFR 71.30. This provides the director may authorize payment for the care and treatment of individuals subject to medical exam, quarantine, isolation, and conditional release.
That I know about, and my office did tell me that. I just didn't know the numbers, ma'am. That's Congresswoman.
Great, so you're familiar. Dr. Redfield, will you commit to the CDC right now using that existing authority to pay for diagnostic testing free to every American regardless of insurance?
Well, I can say that we're going to do everything to make sure everybody can get the care they need. No, not good enough. Reclaiming my time.
Dr. Redfield, you have the existing authority. Will you commit right now to using the authority that you have vested in you under law that provides in a public health emergency for testing, treatment, exam, isolation without cost, yes or no?
What I'm going to say is I'm going to review it in detail with CDC and the department.
Reclaiming my time. Dr. Redfield, respectfully, I wrote you this letter along with my colleagues, Rosa DeLaura and Lauren Underwood, Congressman Underwood and Congressman DeLaura. We wrote you this letter 1 week ago. We quoted that existing authority to you, and we laid out this problem. We asked for a response yesterday. The deadline and the time for delay has passed. Will you commit to invoking your existing authority under 42 CFR 71.30 to provide for coronavirus testing for every American, regardless of insurance coverage?
What I was trying to say is that CDC is working with HHS now to see how we operationalize that.
Dr. Redfield, I hope that that answer weighs heavily on you, because it is going to weigh very heavily on me and on every American family.
Our intent is to make sure every American gets the care and treatment they need at this time of this major epidemic, and I'm currently working with HHS to see how to best operationalize it.
Dr. Redfield, you don't need to do any work.
You don't.
To operationalize. You need to make a commitment to the American people so they come in to get tested. You can operationalize the payment structure tomorrow.
I think you're an excellent questioner, so my answer is yes.
Excellent. Everybody in America hear that. You are eligible to go get tested for coronavirus and have that covered regardless of insurance. Please, if you believe you have the illness, follow precautions, call first, do everything the CDC and Dr. Fauci, God bless you for guiding Americans in this time. But do not let a lack of insurance worsen this crisis.
And I would just like to echo what you said. It's a public health, a very important public health, that those individuals that are in the shadows can get the health care that they need during this time of us responding to this outbreak.
Well, thank you. And the gentle lady from New Mexico, Mrs. Holland, is recognized for 5 minutes.
Okay. Okay, because on the Hill today, no one's sitting up there playing when you have people dying and you have doctor who has the authority, who's over the Center of Disease Control and who has the authority to let people get tested for free. Sit up there and say, well, X, Y, and Z. No. Can people get tested for free, whether they have insurance or not? Is this just for the wealthy or the insured in America, or is this for all Americans? Yes, no question. And you see, this is why you cannot play a game with people. This is the game you don't play. When people try to bring their smug self up there and avoid answering questions that are direct yes or no questions, and they want to talk around the question. They want to deflect off the questions and not answer the question. Yes, no question. So if you think you have the virus, go get tested. You can go get tested. The only thing about going to get tested in different states is, I don't know if every state have test kits available. And that poses another problem. However, it's best that you go call ahead and go to the hospital so you can be quarantined until a test is made available if they don't have one, as opposed to spreading it on to the next person. All right. So again, you heard it from the person's mouth who has the authority to test for free. Yeah, you can get your test, regardless of whether or not you have insurance. Yesterday, we went over some numbers. I did a rough estimate of $1,600. That was my rough estimate for all costs incurred with COVID-19. Well, I will say this, people, please stay safe. Make sure you vote. Make sure if you were not able to get the sanitizers, because people have been at stores, like I said, we started doing stuff as soon as it started getting here. If you did not get ahead of the game, if you did not start preparing in advance, an at-home solution you can make for yourself is to get a gallon of water and put some bleach in there. Put about half a teaspoon or half a cup of bleach in there, and a little bit of soap, and let that be your hand sanitizing solution, because this has always been a fact and always will be a fact. Bleach kills all bacteria and germs anyway. And yesterday I had some doctors confirm that, yeah, bleach will go through there and start breaking it. It'll break viruses down. That's not new to many of us, but for those who were not able to get it, bleach. For many of those of us who had parents who come from the South, we had to take bleach baths anyway. So we need not act new. Most of us, we already know what it is. Bleach is still a good go-to. If you couldn't get the Lysol, if you can't get the hand sanitizer, you couldn't get anything else. One thing that usually every household has or should have, and it's still out there on shelves at this point in our area, is bleach. Go back to the bleach. Like I said, don't overuse the bleach. just enough. If you're going to bathe in the bleach, it's a full tub of water with a cap of bleach. With just one cap, a full tub of water with a cap of bleach. If you're going to use bleach as a solution, antibacterial, germ killing, virus killing solution, a gallon of water, half a cap or half a teaspoon. I said tablespoon. Let me walk that back. Teaspoon, because it's potent, of bleach with a little bit of soap solution in there. And there you go. If you couldn't get to anything else, get to that bleach. So with that being said, I'll see everybody later. Thank you all. Bye-bye, everybody. See you later on tonight. I'm coming back on tonight. This, after listening to this foolishness today, when I was streaming, as I was walking back and forth, whatever, I said, no, I'm gonna come on tonight, because see, all this avoidance and evasive, avoidance from people in authority here in the United States, it's gotta stop. You can make a decision today, make a decision today. She's speaking directly to the person who can make a decision on people's health today, not tomorrow, but today. So I'll see everybody tonight. Bye, everybody.